I've spent a decade taking a bite out of conspiracy theories, unraveling urban legends, and grappling with worldwide top secret issues.
I've even racked up some of their awards.
All while ferreting out the bottom line.
On all topics, controversial, bizarre, and taboo. Interviewing movers and shakers, agitators and muckrakers.
But that doesn't answer my question. That is all I'm answering.
With me, Gary Harrison, as your guide.
Harrison with you with all the hand-wringing about the future of everyone's health care here in the United States, particularly here in California. I want to bring on Peter V. Lee, the first executive director for California's entire health benefit exchange, also known as Obamacare or the Affordable Care Act. What is the future?
All the discussions about repeal and replace leave us with the question of replace with what? And California's put in place competitive marketplaces, help 5 million people get coverage through both the Medi-Cal program and Cover California, our marketplace, and it's working. And that's true not just in California, but in a lot of other states. So I think we all need to take a deep breath and realize that the president-elect and Congress are moving out of election campaign mode into governance mode. And governance mode is one where let's look at the evidence and see what works, and there's a lot that's working.
Thank you for saying that because, the average person doesn't live in the political climate. We just take information that's given, and it's whether it sounds crazy or not, it's what the intent we think actually is. And the fact is, you guys have a whole infrastructure you've built for a whole state, and even just to turn the off switch on or the on switch to off would be a Herculean effort, I imagine.
Well, we aren't thinking about turning anything off. I'm going to be really clear. Here in California, we're partway through open enrollment, and across the nation, open enrollment closes on January 31st. We're focusing on doing our job. We signed up almost 300,000 people for the first time in this open enrollment period, joining 1.2 million who renewed their coverage. And in every state of the nation, what marketplaces are looking at is getting people signed up for affordable coverage. We've got an infrastructure that's working, and we all should be looking at what's working and why, because that's what Congress should be wrestling with as they look at issues of replace. Replace with what? What are the right pieces we want to keep?
I know you've brought in actuaries and other people to study this, and exactly to your point, it is actually working. And interestingly enough, for many Californians, certainly across the United States, people who never could get health care before because they had broken hip once, they had an eyelash out of whack, whatever was going on pre-existing, maybe they were female, maybe they were male, maybe they were this, maybe they were that. All of that has gone away, including the amount of fees one personally would pay if a catastrophic event were to happen. You used to lose your house, and then your 8 generations of family thereafter would go to prison. I'm being obviously very dramatic, but making a point people will resonate with. All of that has gone away thanks to your good work, and it sounds like you're going to continue that in every way you can.
We absolutely are. I'd remind everyone that, look, President-elect Trump has said repeatedly there's some elements of the Affordable Care Act he likes. He likes the fact that people with pre-existing conditions can't be turned away by a health plan. That's revolutionary compared to where we were just 6 years ago. And he says he wants to keep that. He's also said he doesn't want to pull the rug out from anyone with health insurance coverage. Okay. Well, we need to work with those statements and with members of Congress to say, let's build on what works and fix what doesn't, and focus not on playing politics, but focus on delivering a healthcare system that works for Americans.
Peter V. Lee is the executive director of Covered California, which is the statewide arm of the Affordable Care Act, also known as Obamacare, having reminded us that it is not likely to change dramatically, that the best thing to do is to sign up and enroll before January 31st, before January 31st, because as President-elect Trump said, if you have health insurance, he's not likely to take it away from you. Also, the subsidies will continue. The federal subsidies will continue to make it more affordable. You can go to Covered California, Initially, when we spoke, it was that you were presenting the Los Angeles Gay and Lesbian Center with the capability of opening up really a state-of-the-art clinic. And for the first time in much of human history, LGBT people would actually get treated as if they were human. I know it's shocking, but it is kind of a miracle. And some of that is federal money, some of that is state money. If, let's say, Congress decided to defund much of this, how do we still operate in California?
Well, let me be really clear. First of all, covered California, we've got a pretty big budget at this point, but not one penny of our budget comes from either state or federal money. But what does come from federal money is the tax credits that make healthcare affordable. And let's be clear, if you are not Bill Gates, or I guess I should say Bill Gates or Donald Trump, you need financial help to buy healthcare.
Yeah.
Healthcare is too expensive.
Yeah.
Most of us get financial help through our jobs. Every proposal that I've seen from Republicans to replace the Affordable Care Act say a core building block is tax credits to make healthcare affordable. And tax credits is the sort of stock and trade. If we help people take a tax credit and use that to get the private health plan that makes sense for them. So we've got an infrastructure that's working in California. I think we're going to be here for many years to come. And I think what we all need to do, both in California and across the nation, is really, again, focus on what works. But I really do want to note for people listening to this that things in Washington will take time. Every proposal I've seen from, Senate leadership, House leadership say there need to be transition periods, et cetera. But what can happen overnight, though, is you can get sick, you can get cancer, you can get in a car accident. So people that don't have insurance should find out how cheap it really can be. At coveredca.com, in 2 minutes, you can find out how much you can get in terms of health care for a little money because of the federal tax credits that lower your monthly costs. You can find it out quick, and people should be doing that.
I'll make sure to pump that part on our website as well as after we speak. And you actually, Peter, were in D.C. before, so you know that things do take time, that a lot of it is political rhetoric. And just because we hear it on the TV or read it in the newspaper doesn't mean it has already happened or that it even will.
Absolutely. And this is where, one of the reasons California has been really pretty successful, and it's not been perfect even in California, but we've kept rates lower than they've ever been historically. We give consumers a lot of choice amongst private plans. We have benefit designs. This is one thing that's really important, is that you hear a lot of talk about high deductible plans, meaning people can't get access to care. Well, not in California. In California, through Covered California, if you pick a silver plan or a richer plan, and silver is what about 75% of people pick, zero outpatient care is subject to a deductible. You want to go see a specialist, not subject to a deductible. And yeah, there's a deductible if you end up going to the hospital. But it protects you from, actually, as you noted, losing your house.
Yeah.
There's a $5,000 deductible for a family. But that kicks in for a medical bill that might be $200,000. So we really need to be looking at the facts in front of us. And the facts are that what we've done in California really is a model that other states can look to, and that we hope Congress will look to as they make new policy.
Also, if you're feeling politically motivated, like me, you will Google your local congressman, your local senator, just by your zip code, and you can reach out to their office and let them know Medicare must not be monkeyed with. Medicare must remain, because it is, after all, the central organism through which all of the Affordable Care Act remains. The Affordable Care Act, just as a refresher, means no limitations on medical care. It means you cannot be denied medical care from a pre-existing condition. There are caps on the amounts you will ultimately pay. Gender doesn't matter. Sexual orientation no longer matters. And it's something through Medicare we must maintain. Harrison with you. This is The Carrie Harrison Show. You can get podcasts of this and every other broadcast at carrieharrison.com, C-A-R-Y, Harrison.com. One final quick question, and you could tell I'm on your side on this. This is friendly fire, the conversation, because, hey, I lived in Switzerland. I've seen what it looks like when people all have Band-Aids, and you know what? They're pretty happy, I must say. So what you're doing, I vote yes, by the way. So we have people in California who have really low incomes, who are part of LA Care, and I'm in Marilyn Monroe's former apartment. That's where our studio is here. So I know, don't you love it? It's 2017. So we've got a lot of homeless people, and a lot of us are down and out and rely on LA Care or just the total covered ride that you now offer people. Does that continue to the best of your concept here?
It absolutely should. But let's think of LA Care is a great organization. They provide health care to two blocks of people. One is people eligible for Medi-Cal, and that's for people that have really virtually no or hardly any income. For them, they don't pay any premium. But LA Care is also one of the 7 plans we offer in LA area where consumers can pick them. They can pick LA Care or Kaiser or Molina or Anthem or Blue Shield or HealthNet. And the consumer picks the right plan for them. And that's going to be working for years to come, I think. The Medi-Cal funding from the federal government is vital. It's a critical piece of making a real safety net. And I think we all need to make sure that Congress and President-elect don't rip the safety net out from under Californians or people across America.
So that's the key, is making sure that Medicare and Medi-Cal, as we have here, that doesn't get tampered with, because if it does, it might change the landscape to a certain degree. Admittedly, it may take some time. You've been in D.C. before. Most of us have not. Do we contact our senators, our congresspeople, and let them know not to monkey with that?
Not my job there. This is where my job as a civil servant is to do my job, but provide information and education to legislators. We're doing that because, we've got lessons that we are taking to Republicans and Democrats to build on what works. That's our job. The job of actually playing part of the political process. Many of us heard the president a couple nights ago, and he noted the incredibly powerful and important role of all of us as citizens. I certainly embrace that personally, but I'm not going to go there relative to given my role at Cover California.
Understood. And thank you, by the way, for taking time to help us understand what has invariably been complicated only because we've got 68 pundits all saying opposite things. And hearing it from some adult supervision is a soothing emollient on a particularly troubled spirit, I think.
Great. Well, I'm really happy to be here with you. And I think that the number one message is now's not the time to sort of step away from getting coverage. Sign up and get coverage if you don't have insurance. Open enrollment. This is the 4th open enrollment period. It closes down on January 31st. And every day you go without coverage, you're rolling the dice that you may end up in the hospital and walk out with a $100,000 debt. That's a bad gamble.
And as President-elect Trump said, he's not looking to undo it if you already have it. So get in, as they say in baseball, get them while they're hot.
There you go. Absolutely right.
All right, my friend. Thank you so much, and fingers crossed.
Absolutely. Fingers crossed, and let's make it work.
All right.
Have
Thank
a great
you.
day.
Thank you so much. Bye.